Hello, I am Dr. Ahilasamy from Chennai, India. I am going to show a case of right recurrent fungal ball or fungal sinusitis. This patient had a previous surgery 5 years back for bilateral AFRS, allergic fungal rhinosinusitis, that is fungus with bilateral nasal polyposis. I did the surgery 5 years back. Now the present CT scan image shows right maxillary opacity with some opacity in the middle meatus, and soft tissue cuts shows multiple heterodensity with air packets showing it's a fungal sinusitis. It's a soft tissue cuts. I took the patient under local anesthesia with moderate IV sedation to remove the fungus from the maxillary sinus. That's a coronal CT scan image, soft tissue cuts. So this patient, around 55-year-old female. This is a left side diagnostic endoscopy. I have done bilateral FESS 5 years back. The left side ethmoidal cavities, MMA, maxillary sinus, everything is perfect, well healed and everything. No recurrence of any disease, but the right middle meatus has pus and fungal material. This patient complaining of 3 months of nasal discharge on the right side, that's post-nasal drip. This is a fungal material. First step is to suck out all the fungal material from the middle meatus and the incipient pus. I have given pre-operatively 1 week of itraconazole and oral steroids to melt the fungus. After 1 week, I did a diagnostic endoscopy whether everything is rigorous or not, since I have done a very good FESS on both sides and a wide MMA on both sides. Still there is so much disease, so I have taken this case in the theatre under local anesthesia. Gently sucking out all the debris, that's a fungal material and incipient pus from the middle meatus. It's quite thick, but it's part of it has melted to discharge level because of the pre-operative oral itraconazole and steroids. Next, the first step is to pack the middle meatus with a roller gauze soaked in 4% lignocaine and adrenaline in the ratio of 1:1. After few repeated packing, I have taken out the pack. Then I will go for the sphenopalatine block. I am giving at the posterior edge of the MMA, which I have done. That's where the sphenopalatine area, because it's a very big wide MMA, it is almost to the level of the middle terminate, curving and attaching laterally. Appreciate the good blanching by the sphenopalatine block, which is very important. Inject very slowly, otherwise it will extravasate. Patient is taken under moderate IV sedation with remifentanil and propofol. Of course, sometimes I use fentanyl IV along with dexmedetomidine IV infusion. Next, suck all the debris and pus, everything from the maxillary sinus. And the fungal material which has been softened and liquefied is being sucked out. more fungal material is being sucked out of the maxillary sinus. Fortunately, there is no polyps, and already I have done a very good MMA 5 years back, so it doesn't need to widen the MMA and or do any surgery in this case, only to clear the very wide maxillary sinus through the wide MMA. Next step is to do the wet mopping technique. Since it is local anesthesia, we cannot flush the sinus with saline. As I got told several times, the patient will aspirate and cough because the throat, everything will be numb because of the local anesthesia pack which has dripped down into the throat, and anesthetic is the pharynx. Take a long roller gauze, push it into the maxillary sinus through the middle meatus, and do wet mopping technique few times. You can do once, twice, thrice till all the fungal material is dislodged. And now I am using the ring curette. You can use a ball probe or a curved sucker not attached to the suction, and rotate the roller gauze gently without pressure so that you don't injure the mucosa at any point. Gently rotate, rocking, rolling movement few times so that all the fungal materials get dislodged, and you can suck it out later, or it comes along with the roller gauze. This is called wet mopping technique of Dr. Ahila. The pack is being removed out. Remaining small secretions being sucked out. Antrum looks alright. This is with a 70-degree telescope. I have changed to a 70-degree telescope. No more fungal material or discharge. This is a 70-degree telescope view. So nothing to be done more. Now I have changed to the 0-degree telescope. Having a final look at the ethmoidal cavities, MMA, everything all looks alright. Even though CT scan shows some edema of the ethmoids, which is due to the secretions in the middle meatus. Again have a so patient is comfortable. Thank you for watching. Contact me at the address if you have any doubts or queries. Bye bye. See you in another beautiful video.